We'll now recognize Mr. Bean from Florida.
I'm in. Thank you so much, Mr. Chairman, and a very good afternoon to you, to committee members, and especially our witnesses. Let me tell you, one thing you'll always have for the rest of your life, you get to say, that time I testified before Congress. How about that? Not everybody can say that. Mr. Chairman, I know what you're thinking. You're thinking, I look way too young to be a grandfather. How about that? But it is true. And I am blessed with the cutest, most intelligent little toddler grandbaby there is. We think up excuses to take dinner to our kids just to see the grandbaby. We will help them with appointments. And my staff knows that if it says the congressman is babysitting, that cannot be overridden. We will babysit anytime that we get a chance. So the support that we give our kids and our grandchild is I think we'll do anything we can for them. And you know what? It's what our parents did for us, I guess, when I had a kid and Rudy explained he didn't know what he's doing. I didn't know what I was doing either. But there we are, that we give that support. So I can't imagine when you don't have that level of support. By the way, Pop Pop is my code name. Pop Pop and BB. That's where we are. So not to have that support, but enter the MIECHV program, the Maternal, Infant, and Early Childhood Home Visiting Program, created in 2010. Provides funding for lots of groups that can access this funding to provide evidence-based visits in the home, right where it needs to be, to give parents who are facing an uphill battle. And we know if we don't help them, they're most likely to get in trouble, health and whatever wise, to give there. In Northeast Florida, I'm going to recognize the Magnolia Project and the Northeast Florida Healthy Start Coalition that have accessed this program. And I visited with them many times. I was in the state Senate before, and we utilize this program and want to continue it. I know it has a sunset feature, or at least it's going to run out unless Congress acts, so we need to act. So here's a toss-up question for the panel. What happens if this program goes away? Anybody want to jump in? You got to be short and brief, but what is it? Ms. Wilson, you buzzed in first.
So I would say what happens if this program does not continue is that there will still be a whole lot of violence. By having this program, we decrease the violence in the neighborhoods, giving those parents those opportunities to really think about and have access to someone who can coach them through those emotions and those hard parts of parenting.
Nice. No, Ms. Wilson, well done. You're on the board. Anybody else want to jump in? Ms. West, you're recognized.
I'll go. If MIECHV funding went away, it would have a huge impact in Iowa. I know it's a 2-year grant period. We spend all of our money in year one, and if MIECHV went away, over 800 families would go unserved and not have those supports and people to help them understand what parenting is like. I oftentimes say we parent the way we were parented unless we learn a different way. True. Or if we have a parent who helps us through that, and that's home visiting.
Miss West, you're on the board too. Okay, here we go. We hear about this evidence-based, and for those that say this is just another throwaway program, who can tell me what evidence are we basing it on? Who can cite something that I can say, see there, this is how we save money by heading off the pass and preventing these bad outcomes? Who wants to jump in? Ms. Smith, you're recognized.
Yeah, thank you. Well, I mean, the point of like with the youth in care that we're working with, we're providing home visiting, you're looking at 30 to 50% chance of those children going into foster care without this additional help of home visiting. So your first question, what happens if we get rid of home visiting? Child welfare numbers will go up, child foster care, as well as mental health service needs.
Thank you. Thank you so much. Let me say this. There's lots of headlines out there. Don't hold your breath that the headline on whatever newspaper you want to talk about, that Congress comes together. and agrees that the MIECHV program should continue. That's something that we both sides of the aisle agree with. So hopefully we can get it done, Mr. Chairman. I'm on board to make it happen, as is I think everybody on the committee. So with that, Pop yields back, Mr. Chairman.
Well, thank